Over the past few weeks, as all of you know, our healthcare teams and really everyone in Northern Health, our mayors and communities, our leaders in Northern Health, our Northern Health leaders, our Northern Health healthcare workers, our MLAs of all parties, from Shirley Bond, the leader of the opposition, to Nathan Cullen, have spoken up and shown leadership in the need for everyone to get vaccinated. And people in the North have done, I should say, exceptional things in this period. And I want to start by saying today, thank you. Thank you to the healthcare workers who go above and beyond every day. Thank you to the business owners who are adapting the way they operate. Thank you to every single person who has taken the steps to be vaccinated. We are grateful to each and every one of you for stepping up in this difficult time. I want to say that the situation in the North, as we reported in detail on Tuesday and previous to that, is an enormous challenge, not just for the North, but for all of British Columbia. Just to put it in context, 58 people have been transferred by plane out of the North to hospitals, either in Island Health in their majority or in Metro Vancouver. 58. 25, for example, from the two Peace River local health areas. All of them very ill. Some of them without COVID-19, but without room for them at their hospital in their region so that they can get high quality care. But the majority with COVID-19 in critical condition. It's a significant situation when you think about it, when you think about communities and the impact of that, of going from your family, say in Dawson Creek, 900 kilometers to Nanaimo Regional General Hospital or Victoria or Royal Jubilee Hospital. It is a powerful and profound thing, something we would not wish on anybody. They are sick, desperately ill, and it's been 58 so far. On Tuesday, I told you we have 40 base critical care beds in the entire northern British Columbia. That's not for COVID-19, that's for everything. And we've added 23 surge beds to support that. And they're staffed by some of the best teams of healthcare workers in the world. So when you're talking about moving 58 people out of health authorities that have 40 base critical care beds, all of them critically ill, that's a significant situation. And it demonstrates what we've said consistently, which is that we will do what it takes every day to support the North, just as the North did when we needed to support situations in other communities, in Fraser Health, or in Whistler, or in Surrey, or indeed earlier in the North, in Prince Rupert, where significant and special actions were taken to support people in communities. We do this for one another because we believe that that is what we do as British Columbians and as Canadians. We support one another in a public healthcare system that responds. But that being said, it doesn't mean that transfer is acceptable. It doesn't mean that the 260 cystoscopies that we've had to cancel in Northern Health, other patients who need care, who are crowded out of their hospital that they support, that supports them in a public healthcare system because of COVID-19. This is a significant situation, and this in the North. 58 people, 45 of them with COVID-19, all but one of them not fully vaccinated who have been transferred out, demonstrates why we need to continue to take action together, why we need a circuit breaker to address, continue to support all of the other steps we're taking in Northern Health. We are all in. We have thrown everything in but the kitchen sink, and the kitchen sink went in a week ago. We are doing everything we can to support the North, and we will continue to do that. But we also need to ask people in the North to do more. As you'll know, in early August, on August the 6th, we took actions, regional actions, in the Central Okanagan local health area, actions that were in fact taken back on September 13th after progress had been made. We took actions specifically across Interior Health on August 20th because of outbreaks and because of transmission in that region. We took further action in the Northern Health Authority on September 2nd. It was announced here, and it was put in place on September 7th. And then in the Eastern Fraser Valley, that part of the Fraser Health Authority that comprises of Chilliwack and Abbotsford and Mission and Hope and other communities, we took action on September 28th. In a period of vaccination, these specific regional actions and measures are what Dr. Henry and our regional health teams and our chief medical health officers, such as Dr. Kim, who's on the line for us from the north today, have been taking to address situations. And that is what we're announcing today, and Dr. Henry will be announcing today. We are committed to supporting the north every day. We need to take steps together to reduce transmission in the north. And I'm honored, as always, to introduce Dr. Bonnie Henry to detail those steps.
Thank you, and thank you very much, Minister, for expressing the concerns that we've been dealing with across the north. As we know, there are pockets across the province where immunization rates are not high enough to prevent this virus from being transmitted and transmitted rapidly amongst people who don't have that protection. Earlier this week, we expressed our growing concern about the rate of transmission that we're seeing in many communities across the north. And I've been working with Dr. Jung and Kathy Ulrich and our teams to determine what it is that we can do that will put a stop on the transmission that we're seeing now, that will protect people from getting sick from this virus, ending up in hospital. And we know that it's affecting across the province. We are in a very different situation than we were in even a few months ago. The new variant, the Delta variant that we are seeing across the province, almost 100%, is way more transmissible. It spreads faster, and it spreads with a small amount of exposures in a different way than what we have seen with previous strains of the virus that have been in our community in the last year and a half. And we are seeing it cause more severe illness in younger people. So if you were somebody who is young and healthy and thinks, I'm just going to get through this, no problem, that's not the case now. We're seeing this across the province, but particularly in communities in the north where unvaccinated people in their teens, but primarily in their 20s, in their 30s, in their 40s, are ending up in critical care, ending up in hospital. And today, tragically, we had a young person in their 20s die from COVID in the north. We need to take additional measures to stop this transmission, to stop this severe illness in young people, in middle-aged people, in people whose immune systems aren't working as well across the north. As Minister Dix mentioned, we are seeing hospitals and ICU filling up with young, otherwise healthy individuals struggling to breathe with COVID-19. And many people, even if they have mild illness, are now having long-term effects. This is affecting not only the people who have COVID and their ability to get care, but as we're seeing now, it's spilling over into communities, meaning that young people can't get care for the issues they have, people who need cancer treatment, people who have heart attacks. It's now a challenge for everybody in our community, so we need to take additional actions. As you know, regional orders came into effect in September, and today additional regional orders by Dr. Kim, the Chief Medical Health Officer, under the Provincial Health Officer order will come into effect, and we will be stepping up the restrictions that we already have in place across much of the north. We are doing this to stop transmission where it is greatest, and that is those indoor gatherings where we're coming together, where we're not necessarily wearing masks, where we're mixing with unvaccinated people, and this is where we're seeing spread. These changes will apply to the entire Northern Health region with the exception of the local health areas west of Kitawanga, including Terrace, Kitimat, Haida Gwaii, Prince Rupert, Stikine, Telegraph, Snow Country, and the Niska areas. So those are areas where we have seen this virus not being able to spread because of those high rates of vaccination and people taking the precautions that we've asked. But effective midnight tonight through Friday, November 19th, we're trying to make this as time limited to address 2 incubation periods, to stop the hospitalizations, to stop the severe illness. The following orders will become in place. Personal gatherings, both indoor and outdoor, will be restricted to fully vaccinated people only. If you are unvaccinated or have unvaccinated people in your households, then you need to stay with your household only. In addition, indoor gatherings will remain restricted to 5 people and outdoor gatherings to 25 people if they are all fully vaccinated. All indoor and outdoor organized events, so these are the weddings or parties that you are having with an organized event, require a safety plan, a COVID safety plan like what we had in place. It requires everybody to wear masks and to ensure that everybody is fully vaccinated, and that means using the BC vaccine card to ensure that any attendees are fully vaccinated. Indoor events will be limited to 50 people, even fully vaccinated, and outdoor events up to 100 people are permitted. We've had a lot of challenges, and I've worked, and I want to give my thanks to the many faith leaders across the north and across the province. We have put in guidance to help ensure safe practices, but unfortunately, with the amount of transmission we're seeing in the north, it is no longer safe for us to have mixing of people who are unvaccinated in these worship settings. And for the next period of time, worship services will be limited to virtual services only. We can have single-person services where you can go and have quiet reflection in a religious service. But like what we had in the spring, we're now going to be restricting in those areas where transmission is greatest, those high-risk environments, including worship services. We also know that we have issues with people being able to use the BC vaccine card. It is an effective measure, and we've seen that in many communities to ensure that we are mitigating any risk in some of those indoor environments like restaurants, bars, and nightclubs. Right now, we are seeing that those are not enough in areas in the north, and restaurants will continue to allow in-person dining or inside dining with the use of the BC vaccine card. So if you have full service meal service, but we are restricting the serving of alcohol to 10 p.m. For bars and nightclubs, unless a full meal service is provided, these premises with a license to serve liquor must now close at 10 p.m. I'm sorry. Will now be closed for this period of time. In addition, sports events with spectators, so indoor and outdoor, will be limited, as we know, to 50% capacity. They must have a COVID safety plan, and attendees must wear masks when in the indoor setting, and they must use their BC vaccine card to show proof of being fully vaccinated to attend as a spectator. In addition to these changes, we are strongly encouraging people to remain within your community unless it is essential to travel for work or for medical reasons. We know this virus right now is spreading rapidly, and we take the risk from where we come, we take it with us when we're traveling, we bring it into that community, and we take that risk home with us. We know this virus transmits most easily to those people we are closest with, the people that we are with in indoor settings where ventilation may not be great, where we're not wearing masks, when we're eating, when we're talking loudly, when we're singing with each other. Those are the things that we need to scale back now so that we can stop this transmission, we can prevent those people who are not yet protected through vaccination from getting seriously ill. We can take that pressure off our healthcare system. These measures are to stop transmission and to save lives. We're talking about our children who are too young yet to be protected, and people whose immune systems are compromised, where they can't mount a strong immune system, even with the 3 doses that we are now recommending. These are not orders to be gamed or to be got around to try and float the rules because you think they don't apply to you. These are your community members. These are your family members. These are our family members who are being affected. And to support these efforts, we are also stepping up our coordinated enforcement of the BC vaccine cards where they are required to help support those businesses in staying open, being able to support people who are protected to gather in those safe settings. We do not take these actions lightly, and I recognize the impact of what we are requiring of everybody living or working in the Northern Health Region and across the province. We are intending this circuit breaker to save lives, to lower the rates of transmission, to allow our hospitalizations to stabilize, and enable us all to come back together safely to celebrate during the upcoming holiday season, I hope. Along with this, I just want to make people aware, I've talked about this in the last couple of media briefings that we've had, that we are, that a PHO order for healthcare workers outside of long-term care, so in acute care and community care, that order is posted now on the PHO website, and it is broad. It covers healthcare workers that are staff for our health authorities, the PHSA, the BCEHS, Providence Healthcare, anybody who works for the Ministry of Health and Mental Health and Addictions, as well as employees, contractors, and health professionals in the community. So I want people to be aware that it is very broad. It is because we recognize the absolute importance of protecting healthcare workers by making sure we are immunized, to protect ourselves and our families, to protect our colleagues so that we can continue in our very stretched system to provide care for others as well, and to protect those most vulnerable that we care for. The order will require staff to report their vaccination status to their employer, and students are included as well. And staff must have at least one dose of vaccine by October 26. Follow prescribed preventive measures that we've talked about, and get the second dose within 28 to 35 days. If people do not have their first dose by October 26th, then there will be increasing provisions for them to be off work, and progressive enforcement up to and including termination. So the order contains rules for outside healthcare, personal care support, personal service, and other outside providers, as we call them, with respect to access and vaccination status, similar to the requirements already in place for long-term care and assisted living. I also want to say that this order will apply to regulated health professionals in private practice, and I'm working in a process with the colleges to make sure that we have that in place in a way that supports physicians, nurses, dentists, all of the health professionals across our province to be protected and to protect those we care for. I don't have to say this, but the COVID-19 virus is putting us all to the test. And we have seen in some parts of the province where we've been able to manage and to cope and to suppress the transmission, and that is the good news that we're seeing. But there are regions of the province where we have not yet made enough progress to get there. And that is challenging our healthcare system, the people who care for us. It's causing hardship and it's causing loss. But we have a way through this storm, and through the vaccines that we have, and using all of our layers of protection, following all of the public health orders that are there because we know they work to protect us, to keep our families, our communities, and ourselves safe. Follow the guidance we have in place. And let's all continue to do our part together here in BC while being kind to each other and remembering the importance of staying calm and staying safe. Thank you.